Two less talked about COVID symptoms are showing up again, according to experts. COVID-19 cases are once again on the rise in parts of Southeast Asia, including India. While the majority of recent infections in India appear to be mild, doctors are urging the public to remain careful. If you have recently come down with flu-like symptoms such as fever, sore throat, runny nose, fatigue or body aches, it is natural to wonder whether it could be COVID. Interestingly, this time around, two unusual symptoms are getting noticed that were not commonly associated with earlier COVID waves: diarrhea and conjunctivitis, red or pink eye. According to the American Academy of Ophthalmology, pink eye has been reported as a rare symptom of COVID-19. Similarly, a study published by Mayo Clinic had noted that some COVID-positive people experience gastrointestinal symptoms like nausea and loose stools. However, these were never considered classic indicators of the virus until now. Now, with several new cases reporting these very symptoms, they are being seen as potential warning signs of infection, especially if they appear alongside other respiratory symptoms. Doctors say the virus may be taking a slightly different course this time, and while the symptoms remain manageable, it's worth paying attention to what your body is telling you. As per the Ministry of Health and Family Welfare, India had 257 active COVID cases as of the last update, on May 19, 2025. Health authorities have clarified that most infections are mild and being managed with routine symptomatic treatment. Importantly, no serious complications have been reported so far. The two recent COVID-related deaths in a Mumbai hospital involve patients who were already battling chronic illnesses. Medical experts continue to advise the public not to panic. Staying informed, monitoring your health, and following basic hygiene practices like hand washing and masking in crowded spaces can go a long way in keeping yourself and others safe. How to protect yourself from COVID? The best way to stay away from getting a COVID infection is to go back to the basics. Wear masks in crowded places, avoid traveling to areas that are reporting spike in cases, practice good hygiene, and avoid close contact with sick people. If you yourself report some symptoms, it is best to isolate and get tested after consulting your doctor. 2025 COVID-19 symptoms are changing. Here's what you need to know. By InHouse physicians. COVID-19 cases are rising. With indoor gatherings increasing and multiple viruses circulating, staying informed about symptoms and prevention is more important than ever. What are the most common COVID-19 symptoms in 2025? Doctors are seeing a shift in COVID-19 symptoms this season. If you experience any of the following, you could have COVID-19. Cough, dry or persistent. Shortness of breath. Nasal congestion and runny nose. Sore throat. Fever and chills. Body aches. Extreme fatigue, feeling too tired to complete daily tasks. What's different this year? Loss of taste and smell is not a common symptom anymore. Doctors report this has been rare since 2022. When should you get tested? If you have any of these symptoms, take a COVID-19 test immediately. Here's why. Antiviral treatments work best when taken early. They can shorten illness and prevent complications. COVID symptoms overlap with flu and colds, so testing is the only way to confirm your diagnosis. High-risk individuals, older adults, immunocompromised people, need early treatment to avoid severe illness or hospitalization. Pro tip: if you feel unwell, assume it's contagious and stay home. How to stay healthy this season. Get the updated COVID-19 vaccine. The 2024 to 2025 vaccine reduces the risk of severe illness and long COVID. Find a location at vaccines.gov. Washing your hands frequently reduces virus spread by washing hands for at least 20 seconds. Wear a mask in crowded spaces. Protect yourself and others, especially in high-risk settings. Prioritize rest and recovery if you feel sick. Don't push through, your body needs time to heal. Stay tuned for more updates and stay safe.